Hello, and thank you so much for downloading this webinar on healthy eating. We really applaud you for taking this time to learn a little bit more about healthy eating habits so you can continue to be strong and healthy even during these challenging times. This webinar is a part of the Sharp Best Health and Sharp Health Plan's efforts to provide meaningful and helpful resources to Sharp healthcare employees and to our San Diego community to help them engage with their health during this difficult times and continue to be strong and healthy as we are doing this. I am very pleased to join today by wonderful panelists, Julia Vargas and Caitlin Gaho. They're both wellness consultants from Sharp Health Plan, and they are amazing experts in healthy eating and healthy habits. And so I'm very excited to have them today to help us learn a little bit more about healthy eating at home. And my name is Olga Hayes, and I'm a wellness promotion specialist from Sharp Best Health. So, about this webinar, it should take us less than 30 minutes to go through everything, and we will offer some really good insights into healthy eating at home. And at the end of the webinar, we will provide a brief overview of Sharp Health Plan and their health coaching services and some of their wellness resources, as well as a brief overview of Sharp Best Health, which is a wellness program for Sharp healthcare employees. And before we start, I just wanted to kind of explain why we chose this subject. We are going through very difficult times right now with the COVID-19 pandemic outbreak, and a lot of us are dealing with many different feelings, many different emotions, anxiety, stress, sense of loss, uncertainty, and it's very normal to feel all these feelings, and it's very normal to look for ways to cope with these feelings. And unfortunately, sometimes we find coping mechanisms that work against us. And one of them is throwing your healthy eating habits out of the window and turning to food for comfort. Yet it's more important than ever right now is to keep your healthy eating habits at check, because healthy eating is what will help you stay strong and healthy and keep your immune system strong as we're going through these difficult, stressful times right now. So that's why we chose this presentation. And today we'll focus on, first of all, on the benefits of healthy eating, what it means, and what it can do for us, and all the emotional and physical benefits of healthy eating, and some of the challenges of healthy eating, especially during the pandemic outbreak, and some of the healthy strategies to help us eat healthier during the COVID-19 outbreak. And so without further ado, I'm just going to turn it all over to Julie and Caitlin. Ladies, take it away.
Hi, everyone. Thanks so much for the introduction, Olga. We're happy to be here, especially to discuss this topic. So I just want to take a moment to have us all sort of think about why we are really here. You know, why did we decide to click on this presentation and give it a view? And I think a lot of us have our own ideas of what is going to make us feel better about eating healthier. So there's lots of benefits to eating healthier. Sometimes we can feel and we can look good. We can do activities that we want to be able to do. We know that eating healthier often makes us get sick less often. There's evidence that it can help prevent chronic conditions. And it can also help reduce stress, improve your energy, and also decrease inflammation. These are all really important things to keep us healthy and well. Some of these are going to be long-term benefits, and some of them are going to be shorter benefits. So it can just be helpful to just take a second and connect with what your why is, and how, just so you can recognize how you might feel and start to feel differently as you change your eating habits. Okay, so let's really get into what eating healthy generally means. So today we are going to run through nutrition at a pretty basic level, really just some tools and tips for general eating healthy. And the reason for that is because nutrition can get really complex. and getting into really specific information for a certain individual, depending on different conditions you may have or different challenges, can be a lot of information. So this is also just a good time to mention that if you have specific concerns, it's a great idea to talk to your primary care provider. And you might even consider working with a registered dietitian if you have specific concerns or issues you'd like to address. So that's something that's always a resource too, is to talk to your primary care physician about working with a nutritionist. So let's explore what this slide actually means a little bit more closely. So there's some basic things you want to include in your diet. Fruits and vegetables, of course, are really important. Healthy fats, healthy carbs, and fiber. And then, of course, limiting unhealthy fats, less healthy carbs, sodium, and sugar. And to explore those a little bit more, healthy fats and unhealthy fats, sometimes people get a little bit hung up on. So healthy fats are going to be your more natural fats, monopolyunsaturated fats. Sometimes people hear them as omega-3s. You can get these from olive oil, nuts, fish, avocado. These are the types of foods similar to the ones you're seeing in this lovely picture here that are really good, healthy fats. And then on the flip side, things you want to limit are saturated fats. So that's going to be animal products, meat, skin, whole milk, dairy, processed food. It comes in the form of fries, margarine, chips, or even microwave popcorn sometimes has some unhealthy saturated fat in there. So just be mindful of where your fat is coming from and where you see it on your nutrition label, whether it's those healthier fats or those saturated or even trans fats. You want to definitely make sure to limit. And then healthy carbs versus less healthy carbs. So your healthy carbs are going to be your complex carbs, your whole grains. These are a slower processing carbs, which is important to not only give you fuel for your body, but to make sure that they have more nutrition in them as well. And then less healthy carbs are going to be your more processed, simple grains like white bread or chips or things that really don't have a whole lot of nutrition in them. And they also tend to be processed very quickly and it creates a higher glycemic index for your body to process. So, and then sodium and sugar, these are things that we definitely want to limit. They can be really high in processed foods and restaurant foods. So this is just kind of a note to be mindful, checking your labels on things like yogurt, salad dressings, and other condiments. You might be surprised that something that you regularly use in your house is either really high in sodium or really high in sugar or both. So sometimes you might want to consider replacing those items that are a little bit higher in those things. Canned goods or frozen dinners can be very high in sodium because sodium is used as a preservative. So just keep in mind too that something doesn't have to necessarily taste salty to be high in sodium. And then lastly, we also want to make sure that we're hydrating well. And the reason why we want to make sure that we're hydrating is it keeps your body working properly. It flushes out waste. It maintains your temperature, relieves constipation. And, sometimes we get a lot of questions about what's the best way to know if I'm getting enough water or how much water should I be drinking. And I think really the best way is to know that you're drinking enough water and you're hydrated is what we call the urine check. And if your urine is pale yellow, you're probably getting enough water and hydrating enough. But if it's not and it's a bit darker, then you definitely need to be drinking more water. So that's just a really easy way to know kind of where you're at with hydration and making sure that you're doing a good job in hydrating your body.
And another way to ensure you get enough nutrients is colorful eating. So just making sure your plate has different colors on it, like peppers, oranges, lemons, bananas, celery, plums, grapes. Different foods have different nutrients and vitamins. For example, spinach has potassium and magnesium, and carrots have vitamin A. So there's just different ways that you can get different types of vitamins and nutrients and minerals in your diet just by having a colorful plate. And here's some general tips on just how to add more fruits and vegetables into your diet. Keeping a bowl of fruit on the counter, making veggie snack bags for on-the-go items, have cut fruit and vegetables so they're ready to eat, and seasoning your vegetables to make them a little bit more flavorful, and maybe considering replacing or adding spaghetti squash or zucchini noodles instead of pasta. A lot of people have done like half spaghetti squash, half pasta, or half zucchini noodles, half pasta if you don't want to do all of it. Or same thing with mashed potatoes, replacing the potatoes with mashed cauliflower. And I know we were talking about some different ways that to add fruits and vegetables. Julie, did you have an example of one that you do?
Yeah, so one of my favorite things to do with a young son at home is to sneak in fruits and vegetables into some of the things he's eating. So, you might consider putting some vegetables in your smoothies. And a lot of times that's a really great way of getting kids to eat vegetables if they won't. Be mindful though with smoothies that they can be very high in sugar, especially the ones that you might find out and about at different restaurants or shops. So just be mindful that the serving size is appropriate. But I'm definitely a fan of slipping in some vegetables into some of my son's dishes in hopes he won't notice.
Nice. And just some general tips on how to eat healthier. First one would be just to plan ahead, having a grocery list, meal prep for the week, making sure you're having healthy snacks like we talked about with fruits and vegetables out, and then also maybe some nuts, different snacks that are air popcorn, or some great healthy snacks throughout the day. Checking your labels, looking at the serving size, looking at the sugars and the fats. Thinking about your choices, choosing healthy fats over non-healthy fats. So Julie had talked about that before, healthy fats as in like omega-3s with avocados or salmon or fish or nuts. And then limiting processed foods. And then increasing your fiber intake. Again, that comes from fruits and vegetables and whole grains. And then also not to drink all of your calories. We tend to drink a lot of sodas or juices, coffee drinks, and alcohol. So we want to just avoid a lot of those things, maybe limit those things, replacing some sodas or juices with LaCroix or a sparkling water, or maybe adding a fruit or a lemon to your water instead to make it a little bit more fun. So just remember, it's not all or nothing, just small little changes can make a big difference.
So let's chat a little bit about the challenges of eating healthy, especially right now. We want to move into like just breaking down what these challenges are and hopefully provide some strategies for you. We know that in times like these, we can often emotional and stress eat. I know Olga referred to that at the very beginning. We have easy access to less healthy foods, and that is right now, but it's also before the times of the pandemic. Sometimes it's just easier to drive through a drive-through and get something that might be less healthy. It can take time to food prep. So, these things, we have to be intentional about eating healthy in order to make sure that we have better access to less healthy or to more healthy foods. Like I said, it also takes time to do that food prep. And also there's some confusing information out there. And I don't mean that to sound like, nutrition, there's not a right way to eat, or there's not better things you can do for your diet. It's just there's also a lot of new diets that come out, and there's a lot of new articles that will come out about a certain beverage or a certain food, and sometimes that can be really confusing to piece together. So that's why today, hopefully we're focusing more on having that information condensed down to some simpler rules for you to follow, but it can be a challenge. And then lastly, just feeling safe when buying and ordering food. I mean, of course, this is a new one right now when we're dealing with times of COVID, but just making sure that we can feel safe in ordering that healthy food is really important. So with that said, let's move into some of these strategies on how to eat healthier and explore how to deal with these barriers.
Yeah, and one of the challenges that Julie said was emotional eating. And emotional eating is where we're not always simply eating to satisfy our hunger, but where we turn to food for comfort, stress relief, or reward. So here are some ways we can manage that. First, have a list of stress management techniques, such as deep breathing, meditation, mindfulness practices, going on a walk, reading a book. Just a lot of ways to de-stress instead of turning to food. And then practicing environmental control, where we're just controlling our access to food. So maybe not buying those things, but encouraging maybe you to hide those or to get rid of those things, such as cookies, candies, chips, or crackers. So anything that has a lot of calories. And also staying accountable. Maybe with yourself, talking to yourself about it, or having a friend that you can talk to if you're feeling the need to emotionally eat. And then also tracking, portioning, and planning what you're going to eat, as well as pausing before you eat. So just making sure you're being mindful before you eat. Maybe even asking yourself, will eating this alleviate my anxiety? And then making an eating schedule and spacing your meals out evenly. So making sure you have your schedule for morning, for your breakfast, for your lunch, for your dinner, and then also a couple healthy snacks within that time, and including those healthy meals as part of your daily activity. So such as like gardening, watching a show, eating a healthy lunch, like that should be just part of your activities in the day. Another challenge could be accessing fresh foods. So a strategy for that would be to try a local produce box, where you can just get a lot of different vegetables or fruits that you haven't tried before, and you can add that in when you're making your meals for the night. And then also getting your groceries delivered is a way to just make sure you get that fresh every couple days, vegetables and fruits. And then ordering healthier takeout and having a salad on the side, maybe with no dressing or a vinaigrette instead of a creamy dressing, or a vegetable, just a fresh vegetable or steamed vegetable on the side. It's a great option. And third, just to choose frozen fruits. And another challenge may be accessing fresh foods right now. So trying a local produce box is a great option. You can try a lot of different vegetables in there that maybe you wouldn't if you were at the store. And also getting your groceries delivered is a great way to get fresh vegetables every couple of days. And then ordering healthier takeout, adding a salad on the side or a steamed or grilled vegetable is a great option. Um, Thirdly, choosing frozen fruits and vegetables or canned low sodium beans or vegetables. A misnomer with frozen fruits and vegetables can be that they lack nutrition, but actually they're flash frozen, so they keep their nutritional content. And lastly, starting a home garden, if it is feasible, if you have the space. I know I have some fruit trees in the back, and then I've had a couple friends that started some squash and tomato gardens. Just a lot of things that we could add in. I know Julie had talked about how she started a garden.
I started an herb garden of just kind of some smaller things like basil and jalapeno. I think it's great because anytime you can try to opt for fresh foods or fresh toppings in your foods, it's great to have. But I just don't have as much of a green thumb, so I didn't want to get invested in a big garden because they can be a lot of work. But if you enjoy it, I definitely would recommend it. The other thing is I've done a produce box recently, and taken me years to finally actually do it, but I really love it. And you get a lot of fun things to try, and it's just kind of an exciting thing to add to my week every other week.
That's great. Thanks.
So let's talk a little bit about ordering from restaurants, because that looks a little different these days. We get a lot of questions, is it safe to order from restaurants? And in short, it is. But there are some tips to reduce your risk of getting a virus, and that is ordering from only businesses that you feel confident are following high levels of hygiene and food safety guidelines. So those restaurants that you really trust and know. Make sure that you're choosing a low or no contact method when you pick up your food, such as having it dropped off at your door if that's an option, or paying online before you pick up your food. Anytime you can really just cut out more time that you're spending in that restaurant or contacting other people is a good thing. Wearing a face covering, of course, is a requirement right now, but make sure that you're doing that if you leave home to pick up food. Avoid touching shared equipment such as door handles, counters, and touch pads. And then if you feel that this is important to you, maybe even consider transferring the food from your restaurant packaging onto your own plates and storage containers. That can just be a good way to add a layer of safety in your mind when you're ordering restaurants. I know sometimes I get a little fatigued cooking all the time at home right now. And so we want to make sure that we are feeling safe ordering from restaurants, just to give us that break too. And then of course, remember to wash your hands with soap and water for at least 20 seconds. And when you do order from restaurants, make sure that you're picking healthy choices or healthy restaurants. You want to make sure to plan ahead. So think about what you're going to order, about that healthy item before you actually place an order. And this kind of goes for going to restaurants and staying home and ordering, but make sure that you're not ordering food or, you know, arriving to a restaurant hungry, because when you're already hungry, you're going to probably want to order a lot more. So just kind of remember to think ahead a little bit. And portion size matters. So maybe you consider splitting a meal with someone in your family, or ordering a little bit more, but then having that food throughout the week or for a couple of meals. I know I do that just to kind of minimize contact, but then also just to have a little bit more. But make sure that you're staying true to the serving size that you've planned for yourself. And then another thing is we recommend this all the time is filling up on water at restaurants or before you eat, can just really help you feel a sense of fullness before you actually eat, which can help you eat a little bit less. And then this really nice table on the side here is just a few reminder descriptive words of things that you can pick instead, and things that you want to skip. So the things that are broiled, steamed, blackened, baked, roasted, light, fresh, grilled, those are kind of the words to look for that are going to be your healthier choices. And of course, skipping the fried, battered, creamy, buttery, crispy, cheesy, thick, breaded, glazed, all those things with a lot more fat, a lot more sugar, and a lot more sodium. So hopefully that's just a nice go-to list of things that you can choose healthier items off the menus.
So eating healthy at home, a lot of us are cooking, like Julie mentioned, 3 meals a day. So we want to just focus on just a couple healthy eating tips for when we are at home. Bringing your plate to the table, and not the whole entire serving dish. Making sure, like, after you do cook, putting some leftovers away for tomorrow for lunch, or for maybe freezing them. And then also practicing mindful eating. So you're really focusing on slowing down and maybe eating it not in front of the TV, but at the table, and maybe with someone in your family, or maybe over FaceTime. Just slowly eating and really cherishing your food and thinking about what the flavor is. And then we also talked about some substitutions, so maybe picking olive oil versus vegetable oil, or Greek yogurt over sour cream and mayo, or even making your own dressing, so olive oil, balsamic vinegar, or lemon juice instead of a bottled salad dressing. Choosing 100% whole wheat bread over white bread, fresh fruit over canned, and then rolled oats over breadcrumbs. So those are just a couple options when you are eating healthy, to make some choices, better choices at home. And then also saving time with food prep. I know this can be tough when we're at home, but making sure we're pre-planning our meals and budgeting out for every week when you're buying and ordering your groceries. And then also making more and freezing your leftovers, like I mentioned, for additional meals. And then slow cooker is a great option for not a lot of prep, not a lot of cleanup. And it may be a great time to get an Instant Pot. Those can be like 30 to 45-minute recipes. And it's just one pot, not all the different pots and pans when you're making different things. So that's a great way, as well as even like an air fryer right now. So there's so many different options out there to help with saving time. Also, maybe having your kids help in the kitchen with you with prep or cleanup. I know as little as 3 years old, they can start helping in the kitchen, and then even just like, you know, shredding lettuce, or helping set the table. And then lastly, just putting your dishes in the dishwasher. I know it seems really basic, but my sink gets piled up all the time. So just remembering to just rinse that dish off and quickly put it in the dishwasher. Just a great little tip.
So we hope that those strategies are things that you can try and you find useful to help make sure that you're getting the nutrition that you need. So we just kind of wanted to review a few key takeaways for you. Of course, eating healthier is important for your overall health and well-being. You can improve your nutrition by following these few general guidelines. So making sure to eat fresh foods and include lots of fruits and vegetables that contain fiber, healthy fats, and nutrients. You want to avoid processed foods as much as possible. Eat colorfully. Limit your saturated fats, simple carbs, sodium, and sugar.
And then also there's some challenges to eating healthy, but you can get through the barriers by remembering to manage your emotional eating, planning out meals in advance, and being mindful of healthier food orders, and then also substituting healthier ingredients in your existing recipes.
And we also just wanted to make sure that we highlight some of our best health resources available if you need a little bit of additional support. So we do have our best health coaches available. They focus on all sorts of things: weight management, tobacco cessation, nutrition, exercise. It's a no-cost 6-week weekly phone call, weekly program where you do it all over the phone, so you don't have to go anywhere. And this is an evidence-based, goal-oriented program where they kind of customize your action plans and how are you going to get through your barriers. So it can be a really great way to work with the same person and really just kind of work your way to better health. And just, from all sorts of different topics. So we find sometimes people weave in and out of them depending, maybe you start with nutrition, but you find that stress management is really the thing that's causing the underlying issues. So maybe you kind of weave into stress management for a bit. So it can be a really great, effective way to actually get you to make those changes and take those steps to make changes. So as we know, sometimes we know the information, but then how do we put it into action? So they're a really great team.
That's great. Yeah. And I just wanted to add, we had some recommendations of apps. These aren't our apps, but these are just some things that the health coaches have talked about. MyFitnessPal is one of the most popular health apps. It helps you keep track of your daily food and beverage intake, calculating your nutrients, your calories, your vitamins for your goals. So that's really helpful. Also, See How You Eat. It's just a simple photo food journal app to see what you've been eating. This can be helpful for colorful eating. And then also Lose It. It's a calorie counting app that helps you track food and exercise to lose weight.
Thank you, Julie. Thank you, Caitlin, so much for the wonderful, wonderful presentation. And just before we wrap up, I had to do a shameless plug-in, of course, on some of the resources and programs we have available through Sharp Best Health, which is a wellness program for specifically Sharp employees. I know there can be a little bit of a confusion between Best Health at Sharp Health Plan and Sharp Best Health at Sharp Healthcare. But whether it's a pandemic outbreak or not a pandemic outbreak, we all know that working in healthcare is no cakewalk, and our healthcare providers, all our employees, need as much support as possible as far as their health and wellness goes. And so Sharp Best Health is the program that is designed specifically for Sharp employees and with Sharp employees in mind. We have an amazing and exciting mix of programs and resources to help our employees reach their wellness goals and stay healthy and stay well. And some of the resources are just highlighted here on this slide, but we offer annual health screenings, we offer mindfulness training, we offer weight management resources and discounts on gyms and fitness centers. We partner with our health plan on the healthcare coaching program, which is the 6-week program that Caitlin and Julie just mentioned, which is amazing. We have nutrition education, behavior change programs, burnout reduction, and joy cultivation, podcasts, webinars, and a lot more. And so we just encourage you to please reach out to us to learn more about any of these resources, because we really want to support you on your journey to health as much as we can. And with that being said, I think we're done here. Thank you, ladies, so much. Thank you, Julie. Thank you, Caitlin. Again, so much for your time, for your expertise, for your talent, for everything that you do to help our community and our Sharp employees to stay healthy. For any questions, please email us at sharpesthealth@sharp.com. This presentation is available for download on SharpNet, and we will also provide a handout to make it easier for you to have reference to all this information that we've shared today. Thank you again, and bye.
Thanks, everyone.
Bye.